Kaposi sarcoma is a highly vascularized tumor of the endothelial cells lining blood vessels. It's caused by the sexually transmitted human herpes virus 8 in patients that are immunodeficient, commonly due to HIV. It presents with multiple red lesions anywhere on the skin or mucosal membranes. However, it can become more extensive, involving the lymph nodes and visceral organs. Although KS is always caused by human herpes virus 8, there are actually 4 main clinical forms of this disease. Firstly, HIV-associated Kaposi sarcoma. Unfortunately, people infected with HIV are approximately 500 times more likely to have the disease. There's also an iatrogenic version as a result of drug treatment causing immunosuppression, often associated with transplants. A classic type, which is rare and indolent, typically affecting men with diabetes in the Mediterranean. Finally, there's an endemic variant observed in sub-Saharan Africa, which is actually more aggressive and presents earlier. The main clinical feature is the presence of multiple lesions affecting the skin or mucous membranes. At the start, early lesions are usually macular. This term refers to a small patch of skin that is flat and altered in color. Kaposi sarcoma lesions typically have a red-purple color, but may become hyperpigmented, especially in dark-skinned patients. As it progresses, lesions become papular, meaning elevated, solid, and less than 1 centimeter in diameter, or nodular. This refers to papules that are actually larger than 1 centimeter. These may ulcerate and become painful over time. Kaposi sarcoma, in association with HIV infection, may develop at any point during the illness. Generally though, the greater the immunosuppression, the more extensive and aggressive it will be. Accordingly, in severe disease, it can spread to visceral organs, especially the lungs and gastrointestinal tract. To investigate the condition, it's important to remember that Kaposi sarcoma lesions are often typical and easily identifiable, especially in high-risk patients. However, a skin biopsy of the lesion allows for definitive diagnosis. The management of Kaposi sarcoma for HIV-associated disease revolves around drug treatment for HIV. Using highly active antiretroviral therapy reduces the frequency, progression, and development of new lesions. However, local lesions can be managed directly if they're painful or causing cosmetic problems, although they do tend to reoccur. Some options include cryotherapy with liquid nitrogen, surgical excision, and laser therapy. Finally, extensive or internal lesions can be managed with chemotherapy in addition to antiretroviral treatment. I use this mnemonic to remember the progression of Kaposi sarcoma. Lesions start flat, get fat, and then mess with your breathing and chat. This reminds me that they start as flat macules, can progress into raised, fat papules and nodules. Finally, advanced disease might involve visceral organs, including your lungs and gastrointestinal tract. Thanks so much for watching Townsend Teachings. Don't forget to like, comment, and subscribe.